So now next question that the girls are asking, what if I have endometriosis? What if I have fibroids? Now, I'll explain to you what exactly happens in the uterus when you have a fibroid, right? A fibroid is nothing but an estrogen dependent tumor. It's a benign tumor. It's not a malignant tumor, but it's a tumor nonetheless. Okay. So it's an estrogen dependent tumor. So if estrogen is going to be present in my body, of course, the fibroid is going to be there, right? Now, estrogen and progesterone are the hormones that balance each other. If the estrogen goes beyond the level of progesterone, that means there is unopposed estrogen activity. Progesterone is not enough to oppose it, then the estrogen level goes high. And that causes proliferation of cells, and that will form the fibroid, right? So now the fibroid, during the course of the life, the fibroid will keep increasing in size. And this will come to a point where it may cause infertility. What they say is the uterus that doesn't produce a baby produces a fibroid. Why? Because when you're pregnant, that is when the progesterone levels go high and it will equalize the estrogen level. So during pregnancy, the fibroid levels stop, the fibroids stop growing. Now, what do I do if I have fibroids? If your fibroids are less than 5 centimeters, they're not causing any heavy bleeding, then there is nothing you have to do. No medication, no surgery, nothing. But if they increase to more than 5 centimeter, plus they start giving you symptoms like increase in bleeding, sometimes there can be the amount of bleeding can increase, the duration. If you're bleeding for 5 days earlier, and now you start bleeding for 8 days, 9 days, all of a sudden. Plus, during those days when you're bleeding, your bleeding is heavier than normal. That means supposing you're passing clots, too many clots while you're having menses, then you need to get an ultrasound done. There might be a fibroid. A lot of us don't even know we have fibroids because we don't even get an ultrasound done on a regular basis. So you need to get an ultrasound if all these things, there are sudden changes of pattern of menses, or there is increased pain during menses. All these things will tell you that this is the time that you need to get an ultrasound. Also, when you diagnose a fibroid or an endometriosis on the ultrasound, there's nothing to worry about. We have good treatments for it. If the estrogen is increased, what we do, we give progesterones from outside. So we'll give you progesterones from outside as a medicine or something, to insert in the uterus, like a progesterone. There's like a copper tea, a medicated copper tea, which we put inside the uterus. So that will release progesterones and that will stop the growth of fibroid. And then after you conceive, then later on, the fibroids will stop growing, right? So what do you do when you have fibroids and they are affecting your fertility? That means they are not letting you conceive. The fibroid is big enough that it's not letting you conceive. So there are surgeries that we can do to remove the fibroid, and if the size is less, then we can give medicines to control the size. So these can be treated, but we need to get a proper diagnosis, which can only be done with an ultrasound. Also in endometriosis, we'll give you medicines to stop the growth. What is endometriosis? Endometriosis, the glands in the uterus, the lining of the uterus, the glands are supposed to be inside the uterus. Now, if they go anywhere else, they will cause pain. Anything that's not supposed to be its natural habitat, if it goes somewhere else, it will cause pain, right? So that is why you will just have pains every cycle. When you're bleeding, you will have more pain than you used to have, or it will not let you work. It will debilitate you. It will not let you do your regular activities. If that's the amount of pain, the excruciating pain points towards endometriosis. All of us will have some little amount of pain during menses, okay, which will be more during the first 2 days. What is normal pain is when you have pain just before your menses, so that you start feeling, okay, now I'm about to have my menses. That, and plus for the first 2 days, if you're having period pain, that's completely normal. But if you start having pain all throughout the periods, 5 days, 6 days, if you're bleeding, your pain is there all throughout, or there is excruciating pain, or there is pain that's not letting you work, all these things will point towards endometriosis, and you will need to get a treatment for it, because endometriosis can, delay or hamper your conception. So you need to get treatment for it. And after you've taken treatment, what we've seen is the conception is normal, the baby comes out normal, and the pregnancy also can be healthy and normal. So this will not hamper the quality of your pregnancy, but this will need to be treated for you to have a healthy pregnancy. So these are the things that you have to do. You have to first look out and watch out for your symptoms. A lot of us don't even know that these are the symptoms we need to watch out for. So you need to know the symptoms that I need to watch out for. And once I have a little bit of a doubt, I need to go to my gynecologist, get myself investigated, and whatever is the problem, I need to treat it there and then and have a healthy pregnancy thereafter.